joining Gwinnett County Public Library. Today's program is an advanced care planning seminar with our presenter, Dr. Lisa Oliver. My name is Amy Perry, and I'm an adult services specialist with the library. Now, let me introduce our presenter. Dr. Lisa Oliver is a life transition educator and a certified grief counselor who earned her Doctor of Education in Adult Education from the University of Georgia. She is passionate about getting people to talk comfortably about life transitions and death. She wants others to feel empowered to make informed decisions concerning advanced care plans. And that is what she will prepare you for this evening. So now I will turn it over to Lisa.
I am Dr. Lisa Oliver. Thank you for taking the time and coming to Advanced Care Planning. Let me share my screen and start the program. Okay, so this is part of the Life Transitions Education Series, Advanced Care Planning. I also talk about, I have another series that we do palliative care versus hospice care. Another one that I get into detail regarding advanced directives. And then another one that I love to do called Your Funeral, Let's Plan It. Why? So your loved ones won't be arguing what they think you want. But tonight we're going to do advanced care planning. So this is me. As Amy said, I got my Doctor of Education in Adult Education from the University of Georgia. And my research focus was death and dying, emotional work, and informal learning. And what I did was research how hospice care professionals learn what they learn. And the reason why is because our schools of social work and nursing schools, we don't really prepare our people who work in hospice for the actual task of doing hospice work. So, and like Amy said, grief counselor certification for the American Institute of Healthcare Professionals. This is a disclaimer. I am not a lawyer. So any information I provide here is not meant to be legal advice. In this case, regarding advanced care planning, you want to talk to an estate planning attorney. And this presentation serves to educate the public on issues related to death, dying, and bereavement. And all content presented is based upon my personal research. So we all have to have learning objectives because you need to know what you're going to pay attention to. So by the end of this seminar, you should be able to state what advanced care planning is. You should be able to call the process of advanced care planning. You should be able to list the components of an advanced care plan. Explain the known pitfalls of having a healthcare power of attorney or a living will. And you should be able to name a resource on how to start the conversation with your family or loved ones. So I have to read this because I do not, talk extemporaneously well. So let's start with a definition of what is advanced care planning. And this is from the National Hospice and Palliative Care Organization. Advanced care planning is making decisions about the care you want to receive if you become unable to speak for yourself. These are your decisions to make, regardless of what you choose for your care. And the decisions are based on your personal values, preferences, and discussions with your loved ones. So that means basically it's what you want. It ain't what your mama think you should have or what your brother believes you should have. It is what you as the individual wants. Now, why is it important to have an advanced care plan? One is because we are all in search of a good death. If we do think about death, we'll always say something that we want to go quickly, we want to die in our sleep, we want to maybe die doing something that we love to do. Maybe it's crocheting or playing cards or fly fishing. But the truth is that only 30%, that's 3 out of 10 of us, are going to die suddenly. And that's according to the Centers for Disease Control and Prevention. So, meaning die suddenly, you're going to have a stroke, you're going to hit by the bus, you're going to get robbed and murdered, something like that. But the remaining 7 out of every 10 of us are going to die from a chronic disease. So by definition, a chronic disease is something that is not like a cold where you can take an antibiotic and it's gone. It's like cancer, diabetes, stroke, COPD. There's a total of 7. Like for some reason, my mind just lost it. But you get what I'm saying. It is something that you can't get rid of. It's a chronic disease. So instead of dying instantly, the more common process is that you're going to have a slow decline with episodes of system or organ failure requiring you to go into a hospital, to maybe go into a nursing home, and then go into hospice. So it is really important that we plan for these things. Another thing is most of us are going to die at home. Most of us won't. We want to die at home, but we won't. All of us hope to die without pain. And the truth is, many of us will be kept alive in pain beyond a time that we would choose to end it. And the reason is because we have not put things in place. Here's the thing about advance directives. You know, we didn't have any say of how we come into this life, right? But we do have a say of how we leave this life. But the thing is, so many of us will not take the time to spell out the type of a physical, emotional, and spiritual support that we want at the end of life. And this is what I'm trying to do. If we educate ourselves, it won't be the big boogeyman, right? You know, there's a saying that John Underwood, he was the founder of the Death Cafe. He used to say, just like talking about sex won't make you pregnant, talking about death won't make you dead. And that's for real, right? So we can't be afraid of having these conversations, because here's the thing, you know, not everyone can get pregnant or want to get pregnant. But if I were to walk into my neighborhood Publix and ask people, tell me something about getting pregnant, tell me something about giving birth, I bet you 9 or 10 people can say, oh, well, only women can get pregnant. It takes 9 months. You can tell a woman's pregnant because her stomach is big. There's a whole lot of screaming and hollering, so forth, right? Conversely, we are all going to die. And it is not until we are either in the ICU ourselves or a loved one, and we need to figure out what's the next course of action, or we're given a terminal diagnosis. And at that point, a lot of decisions have to be made in a short period of time. And I don't know about y'all, but when I have to make decisions in a short period of time, I'm always second guessing and maybe Monday morning corporate quarterback, should I have done this? Should I have done that? And so here's the thing, if we look death and dying square in the face and make plans, it's going to be easier for everybody. And you will be leaving a legacy of peace and order. And okay, so I said it's important because we all want to have a good death, right? And another reason why it's important, because life comes at you fast. This is just a fictional account, just to show you how life comes at you fast. This is my family. This was back on the beach of Maine in 2018. To my left is my husband, Jeff. I think at this time we were 52. My daughter, Caraway, I think she was 20 at the time, and my son, Justin, he is 21. So again, this is a story, but it's to illustrate how life happens really fast. So we're on our way back to Atlanta, and me and Kara are in the back seat, and Jeff and Justin are in the front seat, and Jeff is driving. We come along a 2-way highway, and a tractor trailer jackknifes, and Jeff tries to, you know, swipe it, but he doesn't make it. So when I say he doesn't make it, like we get hit by the car. So Jeff takes the brunt of the situation, right? So we get to the hospital, he has a ruptured spleen, his insides are crushed, he has cranial bleeding, and the doctor is saying, you know, Mrs. Oliver, I don't know if your husband's going to make it through the night, so tell me what you want. And I immediately go, you know, we need to do everything we need to do. I have good insurance. If we need to get transplants, we can do that. I just, you know, I've been married to this man for 25 years, and you really need to just save this man. And then my daughter comes through and says, well, Mommy, you know, I know Daddy doesn't really talk about this to you, but I really feel as though if Daddy cannot go to Home Depot, if he can't, you know, tinker around the house, if he can't live like he's living, it's really no use of hanging on and making him just suffer, because he's not being the person that he wants to be. And then I have my son who's saying, you know what, as long as Daddy's breathing, he's Daddy, and I have a daddy. So this might seem hard, but it's really okay if daddy just lays in the bed, because that means I still have my father. So you have a family that's really close. Hold on, I jumped ahead too quick. You have a family that's usually close, but in the middle of this stress, they all have three different ideas of what's best for the father, but really it's what's best for them. Well, I gotta say, the daughter has the closest idea of what the father wants, but the key is that we all kind of forgot the person in the middle of this, and that's daddy or Jeff, which brings to mind, what does it mean to live well? As you can see, all three of us had different meaning of what it meant to live well. I had the, throw the kitchen sink at the situation, right? The daughter had the idea of conditionalism, meaning, well, if he can't do this, then it's no use of him living. And the son had the, what's called instrumentalism, which means dad is serving the instrument of being a father. And as long as he's breathing, he's a father, and it's all right with me. But the thing is that we are not taking into consideration what Jeff considers as a life lived well. But that was Jeff's responsibility for writing down his advance directives and telling us what he wanted. So that's why it's really important, because one, we're going to be on this earth for a while and we need to let folks know what we want. And two, life comes at you fast and we need to plan for it. So what can an advanced care plan do for you? Well, in the event that you are unable to decide, meaning you cannot speak for yourself, an advanced care plan will maximize the likelihood that you will receive the medical care that you desire. It minimizes the likelihood that you will be overtreated or undertreated. It reduces the likeliness of conflicts that will happen between your spokesperson, between family members, and between healthcare providers. And I was talking about that, that Monday morning quarterbacking, that second guessing. It relieves the burden of the decision making on the spokesperson or the family member. I am sure that if it had not happened in your family, you have heard of families that had just gone through generational dysfunction. And you ask why, and they'll say, well, she killed mama. It was probably the oldest child. She probably had to make a decision as to withdraw life support. And now all the siblings are saying she killed mama. And so now the oldest sibling is like, well, should I have waited? Should I have done, you know what I mean? So if we just write things down, it would make things so much easier on everybody. But you know what? It's just not writing things down. It's also giving it to the person that you can trust to honor your wishes. And I'll give you some examples later on. What is the process of advanced care planning? There's several things. One, we really need to sit down and think about our values and preferences as it pertains to our end of life. What is it that we want? Do we want to be at home? Do we want to have pull out the stops? Or do you just want to have comfort care? There's this time that we need to do the research and identify what it is we want. The second thing is talk about your values and preferences with the person who you want to carry out your wishes if it comes to that. The next thing is you want to document. It's just not enough to say, I told my sister what I wanted and I expected her to do it. The mind plays a lot of tricks. You might have a conversation with your sister, and then when it comes down to it, she could say, well, Lisa did say she wanted something, but she was kind of joking when she said it. The mind plays tricks. So it's not enough just to talk to someone. You need to document it and you need to hand it over to someone, which is distribute that advance directive to trustworthy individuals. Now, I suggest to do it more than one person, because just because you choose someone does not mean that they are required to do it. They might say, I can't do it, but I'll get into that a little bit later. And so after you think through your values and preferences, you talk about it with someone, you document it, you distribute it. You just don't want to leave it alone, right? We want to review it, periodically review it and update it as necessary, because how you think 5 years, how you think today might not be how you think 5 years from now, right? So you want to review it periodically, keep it updated, and keep those documents distributed to who you trust. Now, what are the components to an advanced care plan? There's actually 3, and I'm going to go through each of them very briefly. It is the Advance Directive for Healthcare, the Physician's Order for Life-Sustaining Treatment, known as a PULSE, and the statutory form, Power of Attorney. Let's go with the first one, Advance Directive for Healthcare. This is the document that gets you the medical care you want and avoid over medication, under medication. It gets you, it identifies what type of treatment you want if you are unable to speak for yourself. What it does, it relieves the caregiver of decision-making burdens during moments of crisis or grief. It also eliminates confusion or disagreement. You know, it might be, if you have 4 children and you had this document and you gave it maybe to the second child, that child has the document that says, this is what mama wants and this is what we're going to do. The most important thing is that this document will speak for you when you are unable to speak for yourself. Part of the part of the healthcare Advance Directive for Healthcare is 2 parts. It's the power of attorney, which is the person that speaks for you, and it's also the living will, which is it writes down what you want, what you don't want, how long you want it for. For example, in my living will, it says, try everything you can for 3 days, and after 3 days, let it go, right? So it identifies your wishes in terms of your treatment. I want you to note that a power of attorney for healthcare differs than a power of attorney for finances. These are 2 different things. Now let's go through what exactly the Advance Directive for Healthcare is. It's a legal document. The individual completes it, and every competent adult should have one. Everyone over age 18 should have one. And the document communicates general treatment wishes, nothing really specific. When I say general treatment, for example, we had COVID. No one could plan for that, right? So it's not like you can have a document say, if we have this pandemic disease, you want to do A, B, and C. That's why you really want to talk to a person and have them understand your mindset and your values of things. A surrogate can appoint, the document can appoint a surrogate decision maker. That is your POA, your, hold on, let me go, for some reason, power of attorney. That's your surrogate decision maker. But the surrogate decision maker cannot do it on your behalf. Can emergency personnel follow this document? No. So what am I saying here? I'm saying if you have an advance directive and you fall out in Publix and you have this advance directive in your pocket, they need to stabilize you till you get to the hospital and you get to see a doctor, right? So how does an advance directive activate it? The attending physician and another physician have to come in agreement that you are unable to answer questions for yourself. And then in that regard, that's when the advance directive is activated. So it's a legal document, it is not a medical document. Ease in locating. It's no set location, but I'm gonna tell you, in Georgia, I know they have the yellow dot program, right? And they implement it in a lot of senior living facilities. And you can go online and look up yellow dot, but essentially there is a yellow circular sticker that you put in your window or on your door. And if the EMTs come, they know to look for your document. So it might be on the back of the front door, or it might be on the refrigerator, but that is one way, if you live alone, that you can have the EMTs know where your documentation is in the event that you come ill. And the periodic review. review. The patient is responsible for periodically reviewing that document. Before I go further, does anyone have any questions regarding Advance Directive for Healthcare?
Okay. The other question is, where would these documents be found? And are these documents should be with your will? So it's kind of a two-part question.
Okay, so the documents, if you go to AARP, anywhere, because it's dependent upon the state. So like I said, I'm going to, on my website, you're going to, if you go to the drlisaoliver.com/resources, I have a list of advanced care planning sites that you should be able to go to. No, it shouldn't be what you will, because here's the thing, and it's so funny because when I tell people what I do, the first thing they'll say is like, oh, but I got a will, I'll be fine. For real, a will is not any good until you're dead. So you really want to have, again, if you can have it taped to your door or taped on top of the refrigerator. Again, if you go to the Georgia Yellow Dot Project, they can give you ideas of where you want to keep this type of information. So if that's all on Advanced Directive for Healthcare, I am going to move on to.
Lisa, before you move on, there was one last question with that.
Oh, I'm sorry, go ahead.
Okay, so this one is, if I've written an advanced directive, is it set in stone once I sign it? Or am I able to go back and make changes at will?
Definitely go back and make changes at will, and then what you want to do is date it. No, nothing is ever set in stone. You can always you can always download it and and do a new one, or you can just make an addendum. But I think also it's important too is that you hand it and you give the updated copies to the people that you trust to honor your wishes.
And there's one last question in regards to these documents. Do the documents need to be notarized?
That depends upon the state. In Georgia, it's no. But a healthcare advanced directive for healthcare does not. Now, when we start talking about the financial part of it, yeah, they do need to be. But in Georgia, no. Okay, so I'm going to move on. The second part is the physician's order for life-sustaining treatment, otherwise known as a POST. And this is only if it's applicable. Now, here's what a POST is. It originated in Oregon in 1991. Advanced directives really only kind of started in 1989, but it really started becoming more common in the United States in like 98, 99. So this document is to be completed by your healthcare professional with your input. You're only supposed to use this if you, the patient, is not expected to live another 365 days. So this is something that your healthcare professional, again, it depends upon the state. It could be a nurse, it could be a physician, it could be a physician's assistant, but this is a document that gives explicit orders of how you're supposed to be treated in the event that you get into an emergency situation. Now that this type of document is medical. Remember I said the Advanced Directive for Healthcare is legal. This is a medical one. Who completes it? A healthcare professional. And anyone who is seriously ill or frail, regardless of the age, if the person filling it out does not believe you're going to live another 365 days, this needs to be completed and you need to have a copy of it. This document communicates specific medical orders. And it also, when you do this document, when you complete this document with your physician or your medical professional, you also need to have your surrogate in there too, so everyone understands what's going on. Can emergency personnel follow this document? This is a yes, because this is a medical document. This is just as if your physician is right there with the EMTs. If you have this document on you, the EMTs are to do exactly what the document says. Ease of portability. The patient has the copy, Since a lot of entities have electronic medical records, that should already be on file. But again, Georgia has the yellow dot project. And if you have the yellow dot in your window and have all your documents together, that would be real easy for everyone to find it, and just keeps everything, in decency and order. And a periodic review, a healthcare professional is responsible for keeping this updated. Okay. So I know I threw a lot at you, right? What is the difference between an advance directive and the physician's order for life-sustaining treatment? So let's go through them side by side. So the pulse is a medical, and the advance directive is a legal document. And that means that if you fall out at Publix and you have a pulse with you, the EMTs have to do exactly what that document says. If you fall out and you have your advance directives with you, all they're going to do is, you might have a do not resuscitate, but they as the EMTs have to stabilize you and do whatever they need to hand you off to the hospital so they can make those decisions. Who completes the document? With a pulse, a healthcare professional completes the document. With an advanced care directive, the individual does it. Who should have one? With a pulse, anyone who is seriously ill, anyone, it doesn't matter the age, as long as the healthcare professional believes that you will expire within the next 365 days, you ought to have that document. Regarding an advanced directive for healthcare, all competent adults should have that. If you have a special needs adult, that's when you need to get an estate planning attorney, because there are certain things that need to be taken in consideration when you are responsible for an adult. What does the document communicate? In the pulse, it communicates specific medical orders. On the advanced directive for healthcare, it's just general treatment wishes, right? So the treatment wishes are, if you are in dire straits, you don't want to be have the kitchen sink thrown at you as far as your getting you well. You just want to have comfort care. So it just talks in generalities. Regarding the surrogate decision maker role, you want to, as the surrogate, you would want to be in discussion with the physician regarding the pulse, just to make sure that everyone understands what is going on. Now, the decision maker cannot complete the advanced directive for healthcare, because again, the individual needs to complete that. Can emergency personnel follow this document? If it's a pulse, yes, they can. Actually, they should. If it's the advanced directive for healthcare, they cannot. Their purpose at that point is to stabilize you and get you to the hospital. Who has, let me see, because I'm looking at y'all, but I'm looking at my other screen, right? So the ease in locating portability. The patient has regarding the pulse, the patient has the original and the copy is in the medical record. And if there's a state registry, it should be there. With electronic and medical records, it should be pretty easy to locate somebody's pulse if there is one on file. Regarding advanced directive for healthcare, there's no set location, but it really is the responsibility of the individual to keep it updated and to keep it somewhere where everyone can find it. It's really no good having a pulse in the safe deposit box, right, at the bank. These are things that you need to have on you, and they need to be, if you don't have it on you, you need to have it accessible, right? And who is responsible for updating it? The healthcare professional is responsible regarding the pulse, and the individual is responsible regarding the advanced directive healthcare. Amy, you was going to ask me something?
Yes, there's one question kind of along this line. If you could clarify a little bit more about what the yellow dot is.
Oh, the yellow dot is a program that's in the state of Georgia that a lot of senior living facilities are utilizing the program. And so essentially you get this packet, and in the packet is like a clear envelope. You get a yellow dot, and it's adhesive, and you would affix the yellow dot to the window, to your window of your home. And so when the EMTs come, they know by seeing this yellow dot in either on your door or on your window that you're part of the program, and that your advance directive or your pulse should be either on the refrigerator or behind the front door. So it's a program that the state of Georgia implements. If we have time, I'll try to look it up on email just to show you guys. So did that answer the question?
Yes, we're good.
Okay, cool, thanks. So the third component, the first component was the Advance Directive for Healthcare. The second one was the pulse. And the third one is the statutory form for financial power of attorney. So this financial power of attorney authorizes someone to act on your behalf in financial matters if you are no longer capable. And if you think about it, this is really an important one, almost more important than, the healthcare one, because most of us are on a 30-day cycle, right? We pay our mortgage, we pay the phone. And so in the event that you have money in the bank, but no one can get access to it, a lot of things while you're trying to heal are in limbo because no one has access to the finances for the exception of you. So this is really an important document. And this is not something that you can fill out. You would need to go to an estate planning attorney and they can talk to you about the ins and outs because, what it is suggested, for example, that the healthcare power of attorney not be the financial power of attorney for obvious reasons, right? Because maybe you're in a relationship and the person is ready for you to die so they can go to Tahiti with all the insurance money. I don't know, but you know what I'm saying? For obvious reasons, you kind of don't want to have your healthcare with your financial person. But those are things that you talk about with an estate planning attorney. And the thing also too is that if you are incapacitated, this cuts out the middleman, so to speak, meaning the court system, and that there can be, you take the document to the court, it shows that you are incapacitated and it's already handed over to you. It's not a whole lot of rigmarole going through who's going to have access to the money. And I'll give you an example pretty soon how it's really important that we need to have our ducks in order when it comes to things like this and not wait to the last minute. But again, this is something that you want to go to an estate planning attorney and talk to them about. Known pitfalls with healthcare power of attorney and living wills. This first one, and these are all, like this one's from the New York Times Magazine, and it's called Pitfall for Proxies. And the basis of this article was that you need, just because you love someone the most, that might not be the person to make your decisions for you. And they had two stories from this one. And the first story was a husband and wife. They were married about 40 years, right? And so, the lady had advance directives and the husband was the power of attorney, but the husband realized that with the wife dying, he will no longer be a husband anymore. And so he got into his feelings. And so instead of honoring his wife's wishes, he went along and had all these tests done and all these things done. And she eventually woke up from this coma and she realized what her husband did. And, I'm not going to say, of course, they're not divorced, right? But that trust was broken because the husband put his needs of still having a wife above his wife's request that she die without a whole lot of heroics. The second one in this story is about a father and a son. I think it was a family of 4, but all that's left now is the elderly father and the son. And so the son was called to the bedside to make some decisions. The father said he did not want any heroics going on, but the son, he feeling guilty because he hadn't spent a lot of time with his father. So he, the ICU folks are not going to let you just lay there in bed. They're going to ask, well, we need to do this test. We need to do that test. So the son, subjected his father to all this unnecessary stuff so he can have more time with the parent, right? So again, this is a situation where the father had made it plain that he did not want certain things. He wanted to go in peace, and the son said otherwise. And all the stuff was written down, but because the person had the power of attorney, they can, the healthcare power of attorney, he could dismiss everything the document says. This is, these are two examples where just because they're related to you doesn't mean that they're going to be, trustworthy enough to honor your wishes. The second one is from the New York Times again. The patients were saved. That's why the families are suing. Here's the thing, in the West, we are just in awe of costumes, right? And when I say a costume, when we see a doctor, the doctor has on their white coat, they have on the stethoscope, they have something that says such and such MD, and we will capitulate to them, right? The doctor may say, oh, well, I think we had this therapy that can help your mother if we just do this. Your mother clearly stated that she did not want anything, but because we see a doctor, we say, ooh, maybe the doctor knows more than what we know. This is why you need to have this document, right? You need to have the Advance Directive to Healthcare that has your mother's signature on it that says, no, my mother did not want any extra things. This is a document, and this is what we're going to do, doctor. So these were situations where, these healthcare, these people who have power of attorney were able to be persuaded by other people to, take on these extra things. And so here's one thing I want to tell you. If in the event you have a healthcare directive and you do not feel as though you are being heard, there is something called a hospital ethicist. Every hospital has an ethicist. And if you don't believe that you're being heard, number one, you can ask for another physician. And if you still don't feel as though you're being heard, you can ask for the hospital ethicist. And you can have, it's not a trial, but you can have a meeting where this ethicist will listen on your behalf and listen to the physician and try to get everyone to come together. So you're never really alone in the hospital, but these are things that we just don't know. But this is why it is so important, because this little piece of paper is so powerful. It is powerful against the siblings who want things to happen another way. It's powerful against the healthcare industry. I mean, come on, a lot of people in the healthcare industry, right? They might have grants and something that has to do with the research of kidney treatment. And this person, your mother, is the perfect person that would be a great candidate for this testing. You don't know that. But what you do know, you got this piece of paper and your mama said she didn't want this. This is why it is so important to have documentation, to give it to people who you trust to honor. You trust them to honor your wishes. And not only do you trust them to honor your wishes, but they're going to be a pit bull about it, and they're not going to capitulate to the pressures of making decisions. The third one, it just reminds me, you can do everything you want and stuff still might not go your way. You see this man here, he had tattoo, do not resuscitate. And that little circle, he put his initials there. So here's what happened. So they find this man, he's laid out, he's drunk. And so they take him, he's drunk. I think he had a heart attack and he's drunk. So anyhow, he is in bad shape. They get him to the emergency room, they rip his clothes off, and they see this, do not resuscitate. They didn't know what to do. They ain't never seen anything like it. And so then they went to the ethicist, what should we do? And so then, it's all these things. Well, maybe he got drunk and he lost the bet, and maybe that's why he got that put on. So they didn't know what to do, but finally, they got a court order. The social worker was able to go to his house, find his advance directive, and he was able to die in peace. But it took a lot of days, right? Until they couldn't figure out what to do, because no one has ever seen a tattoo that says do not resuscitate. So this is one of my favorite stories, because you could do everything you wanted to do and you can still end up not dead yet until they can figure out what to do. This is John Singleton. He was the youngest Black director. He made a movie called Boys in the Hood. This is so real life. I could not believe it as I was watching this go on. So John Singleton, I think he was 48. He had a severe stroke. He didn't have Advance Directive, but he had several kids, right? So his mother, who was his business manager, was trying to make decisions regarding John's care. John's children were saying, no, we don't want to do this. I don't trust you. You know, you're just after whatever. Not only did John not have an Advance Directive, John also did not have anyone to take care of his finances. So what happened? John's mother goes to the courthouse to try to get control of his finances. One of the daughters are saying, no, you shouldn't have control of finances because you waste all his money. So where are they? The mother and the child are all at the courthouse trying to battle out how to get control of John's money. Now here's the sad part. They really should be at the hospital rubbing on John. Oh, we love you, get better. Or if he's not going to get better, talk to him and you know, have good family time. But instead, they're at the courthouse fighting each other over money. So eventually, the court gives John's mother power of attorney and gives her financial power of attorney. So that part's done. So John, eventually his stroke is severe and John eventually dies. Now John had a will, but John did not, he got the will done after the birth of his first child. Meanwhile, he had 6 more children. So these 6 more children are not in the will. So let's just say, I'm sure he had more than $1 million, but let's just say John had $1 million. So you got the other 6 children fighting the one child for the money. And so because there were different mothers, so let's say there's 3 different entities fighting for this money. And so between the lawyer's fees and everything else, they might all end up with $3.35, right? So it's just crazy that when we don't take care of things, like John Singleton, he left this mess for his family to fight over. And probably the family, you know, again, instead of loving on each other and talking about how great a father he was, they're all in court trying to get their little bit of money. And so it's things like this. So he did not leave a legacy of peace and order. And, you know, there's a lot of stars. I mean, Aretha Franklin didn't leave a will and Prince didn't leave a will. And there's a lot of people who don't leave a will. But you know what? For the regular people like us, we need to leave advance directives and we need to handle our business because we need to leave a legacy of peace and order. So resources, how to get your loved ones and families to start talking about it. And I know we're almost done, so hold on. So this is my favorite one. It's called The Conversation Project, my favorite website. Ellen Goodman, she used to be a columnist for the Boston Globe, right? And she was very close to her mother. But then when her mother was dying, she realized they talked about everything except how the mother wanted to end her life. And so she was so distraught about, you know, that these conversations that we missed. She started the Conversation Project. And what's really cool about that is that depending on the situation, because, you know, sometimes I have parents who can't talk to their children about their end of life choices. I have children who can't talk to their parents about it. You know, there's all situations here and you get like a kit of how to start the conversation about end of life and how you want it. So that's a really good one, the Conversation Project. And then here, these are all the resources on advanced care planning. And so again, these are not an endorsement. These are just things that I looked up or came across in my research. And if you go to drlisaoliver.com/resources, you can download a PDF of all these resources right here. And actually, it's something cool called Digital Advanced Planning. If you go to those websites, My Directives or Vital Decisions, you can kind of put that, keep it on your computer and have it up in the cloud. So, these are my references. Oh, this is me. You know, you can go to my LinkedIn. I have a blog called Dying and Death Talk. Just all kinds of things, death, dying related. So that is it. I'm gonna stop sharing.
Thank you so much, Dr. Oliver, for giving us your time and this important information to share with our community. And hopefully everyone has learned something new and can go share it with others so that we can open up that conversation to speak more comfortably about end of life, those hard decisions that we have to make. So again, we appreciate you joining us.
Have me, Amy. I appreciate it.